All right. So welcome everyone. Bonjour tout le monde. Thank you for joining us for today's webinar. My name is Ina Shalala. I'm the Director of Learning and Partnerships at Philanthropic Foundations Canada, PFC. For those who might not know, PFC is a member association of private and public foundations, charities and corporations all across Canada. So today's webinar will focus on the global response to COVID-19, opportunities for Canadian philanthropy. As you know, most of the granting made by Canadian foundations is domestic in nature. The COVID-19 crisis is really highlighting the interlinkages between what happens abroad actually does affect what happens here. And so this webinar will discuss how Canadian philanthropy can contribute to international efforts to combat the COVID-19 pandemic. I'm joined by a great panel today, I have to say, which I'll be presenting shortly. But before we jump into the introductions, just a little housekeeping before we get started. If you have any questions during the conversation at any time, please type them into the Q&A box at the bottom center of your screen. We will try to answer as much as possible during the Q&A period at the end of the webinar. And I wanted to inform you also that the webinar is being recorded, and you will receive a message after the webinar which will include a short survey as well as recording and complementary resources that our panelists have shared with us. We have the pleasure to have a great panel today, and I'll start by introducing Dr. Peter Singer. Dr. Peter Singer is the special advisor to the Director General and Assistant Director General of WHO, the World Health Organization. He was the architect of WHO's strategy and its $3 billion target. Dr. Singer works with colleagues to guide consistent strategy implementation of WHO program budget, results framework, and first investment case, and provides leadership to the Secretariat of the Global Action Plan for Healthy Lives and Well-Being to strengthen collaboration for better health and among 12 multilateral agencies that channel 1/3 of development assistance for health. Before joining WHO, Dr. Singer was Chief Executive Officer of Grand Challenges Canada. And in 2011, Singer was appointed Officer of the Order of Canada for his contributions to health research and bioethics, and for his dedication to improving the health of people in developing countries. Dr. Singer, thank you for being with us today. Our next panelist is Jennifer Brennan. She is the head of the Canada program at the MasterCard Foundation. Jennifer has led public policy negotiations on behalf of Indigenous nations, advancing key issues including education and land rights. As an advocate, analyst, and facilitator, she worked within and for Indigenous communities and organizations throughout Canada for 20 years. Jennifer served as Chief of Staff at the Assembly of First Nations, and prior to that, as Director of Strategic Policy, serving all First Nation governments and working across sectors to enable strategic advancement in fiscal relationships, legal and policy developments. She serves on the board of Gathering Voices Society, the Circle on Indigenous Peoples and Philanthropy, is a member of the Global Access and Inclusion Network on Higher Education, coordinated by the American Council on Education, and was recently appointed to the board of the Royal Society of Canada. Our next panelist, Benoit Fontaine, is the Executive Director of the Kingwood Foundation Canada. Passionate about the philanthropic sector, he joined the Kingwood Foundation in 1999, which is the largest foundation in Belgium and a major foundation on the world stage. He was in charge of various programs at the Kbf, and to cite just one example, Fontaine led the Observatory of Associations and Foundations, which compiles data and trends on the charitable sector. Before joining KBF, he was the director of a youth association and then the president of the Fédération des Centres d'Information pour Jeunes. Our next panelist is Nicola Murray. He is the CEO of the Canadian Council for International Cooperation, CICIC, national association representing the over 2,000 international development and humanitarian organizations in Canada. Driven by a commitment to social justice, he began his career in international development in Ethiopia. His work at CICIC focuses on supporting sector impact and driving sector-wide policy advocacy. In 2016, he was named as a top 40 under 40 recipient by the Ottawa Chamber of Commerce and the Ottawa Business Journal. And last but not least, our facilitator for today, Hilary Pearson. Hilary Pearson has had a 20-year career in the field of foundation philanthropy in Canada. As the founding president of PFC, Hilary has worked with many of the largest private charitable foundations in the country. She has been a strategic advisor and facilitator for many family foundations. Author of numerous articles, blogs, reviews on philanthropy, Hilary also speaks frequently at conferences and workshops in Canada and globally. In 2019, she was appointed co-chair of the Advisory Committee on the Charitable Sector, advising the Federal Minister of Revenue on federal policy and regulatory issues, and serves on multiple boards. So thank you all for being with us today, and hi everyone, and thank you for taking the time to speak during this webinar. Now, without further ado, after these long introductions, I will turn the mic over to our panelists and to Hilary Pearson as our facilitator. Thank you.
Okay, thank you very much, Ines. I really appreciate that. And thank you to all the panelists for being willing to join this webinar, which I think is very important. Just a quick personal note, I wanted to participate in this webinar and was invited to do so as moderator because I think that global philanthropy and the response of philanthropy to a global crisis is an absolutely crucial topic for discussion. I am a member of the Kingwood Foundation Canada board, and I was glad to join that board after I left PFC because I do think that connections between Canada and global philanthropy are very important. Certainly, this pandemic is proof of that. We cannot ignore what happens outside of our own borders. And we also know that there are a number of Canadian foundations that are interested, such as the MasterCard Foundation, extremely interested in working around the world. So this brings Canada to the world in a very important way. So I'm going to ask our panelists to answer some questions, and then I hope that we will have a bit of time at the end of the discussion, or at the end of the presentation from the panelists to take some of your questions as well as participants. So Peter, I think we should start with you. You are clearly the preeminent person on this panel when it comes to talking about global response to the pandemic. You are there at the heart of the World Health Organization. So can I begin by asking you to help us understand the global problem posed by the pandemic from your perspective, and where do you think we are at this point?
Thank you. Thank you very much, Hilary, and greetings from Geneva to you and to everyone. Where we are in the pandemic as of today is that there are about 3 million cases around the world and about 205,000 deaths. Unfortunately, despite all the suffering and economic hardship that's happened so far, the worst may lie ahead. That would be in the form of many people at risk throughout low and middle income countries, but also possible future waves in Canada. In terms of the response, this really is something where Canada has an incredibly important role to play, to your opening comments, as a global as a global country and very interested in multilateralism. The international agencies, the United Nations system, civil society are all very important in this. And just to sketch some of the outlines of the response, the World Health Organization is really, I think, at the center of the global leadership and coordination of the response. And let me just finish this, if you will, situation analysis by saying what are some ways in which the global response, the World Health Organization, is responding. Firstly is the issue of global leadership and global solidarity built on national unity. Secondly is the issue of data and early warning. And the World Health Organization warned early and often before declaring its highest level of alert on January 30th, the global health emergency. And that tomorrow is 3 months from that date, January 30th. Thirdly, the World Health Organization provides guidance and support to governments through 149 country offices, more than 70 surge missions, and it's issued more than 40 pieces of guidance. For example, what are the criteria that governments and countries might use to ease back on lockdowns. Fourthly, the issue of supplies, solidarity flights in partnership with the World Food Programme, going throughout many parts of the world, throughout Africa, and they have delivered millions of diagnostic kits, personal protective equipment, masks, goggles, and oxygen, and so on. Fifthly, the training of health workers. 2.3 million health workers throughout the world have been trained. And finally, research and development. Dr. Tedros last Friday, the World Health Organization's Director General, launched something called Accelerating COVID Tools, which is research and innovation in diagnostics, therapeutics, and very, very importantly, vaccine, along with many partners and many heads of state. And there's actually a pledging conference for that coming up on Monday, because the final exit strategy here is science and a vaccine. And in closing, let me just say that when you think about the global response, also think about Canada, because these things are so closely intertwined. A vaccine, for example, or the type of guidance I mentioned, and the important role of Canada in the world. Thank you, Hilary, for the opportunity to sketch the problem and a little bit the contours of the global solution.
Thank you, Peter. Perhaps I could follow up by asking you to speak briefly about why the World Health Organization, in conjunction with the UN Foundation and Swiss Philanthropy Foundation, decided to launch a fund, a COVID-19 Solidarity Response Fund. And how will that fund help in the fight, in global efforts to fight the pandemic?
That's a question I can answer much more briefly, Hilary, and it's in the name of the title of the fund, which is Solidarity. We're in this together. We won't solve it if we won't work together. Every sector, every country, and within each country, every party, national unity. This is the basis, actually, of an effective global response. And so that's why actually the fund was launched, so we could solve this problem together. And hopefully that applies to many people in your listening in the audience today. And I know we'll come to the details of that. In the 6 weeks since the launch of the fund, it's raised $209 million US, and very importantly, from 279,000 individuals and hundreds of companies and foundations. And so in a word, it's really about solving this together. That's why we launched the fund, why the UN Foundation, the Swiss Philanthropy Foundation, and its Canadian partner, the Kingwood Foundation, Canada, and Benoit will provide more details about that, launched the fund. Solidarity, solidarity, solidarity. We can only do this together.
Thank you. And yes, as you say, Benoit will probably be able to fill in some details when we get to his part of the conversation. But I just want to segue from that into talking to Nick next. Is the indication of the donor interest, and especially individual, which probably also includes some individual foundations, the indication of interest in this fund that is evidenced by 6 weeks to over 200 million US in contributions, pretty significant. So Nick, turning to you, how do you see Canadian civil society and international non-government organizations based in Canada participating in this global effort to cope with the pandemic? And do you think there are some new opportunities here for Canadian INGOs to engage more with the global effort?
Well, thank you for that, Hilary. And I really just want to start with a big thank you to you and to PFC for the invitation. I know the work that goes into an event like this. And so thank you very much for doing this, an important conversation, because truly we are not alone in Canada with this crisis. It's a global crisis and it requires that we work all together. And so sort of tipping my hat to the messages that Peter was ending up with there. At CCIC, we represent the 2,000 plus organizations that work in international development and humanitarian response in Canada. They've been working around the globe, are in every country in the world, supporting a range of social programs and trying to advance human progress around the world, and have found themselves as civil society in Canada very much on the front lines of responding to this crisis. And so you can imagine that they as organizations are very diverse, work in health spaces, work in education, work in livelihoods, nutrition, water and sanitation, food security. The fact is that we're in a very different world today, but where needs are really very much urgent. And civil society finds itself in Canada and elsewhere beginning to fill the gaps left often by governments that can focus on essential services. And so transitioning some of their work to essential services, addressing the spread of information and appropriate information, serving to protect as well marginalized groups, which too often get missed or fall through the cracks. I think we've seen a lot of repurposing of existing programs and networks to support really extensive responses, and some of them are very organic. And I will say around the globe, the solidarity is massive. I've been tracking a group in Tunisia that set up a Facebook group that brought over 100,000 people together to coordinate how they would support, addressing, mitigating the risks of COVID response. And so volunteer teams setting up to do, sanitation work, to distribute information, raise money, collect medical supplies, distribute them. Our members and our networks are involved in a range of similar types of initiatives across the world and trying to grapple with the reality of working now without being able to travel. And so greater respect and partnership with the organizations with whom we work right around the world. I think there's really critical issues we have to be looking at as a sector in not only addressing the core needs right now, but fighting disinformation is a really important point. And the advocacy that we do as civil society is critical as well. So much of the ground is shifting under our feet. How do we make sure that we don't lose the collective progress that we've been making towards gender equality or better living standards across the globe in this context? How do we continue to fight climate change in this context? There's a lot of advocacy, I think, that's needed there. A lot that can be done from a Canadian leadership perspective as well. I want to really signal a couple of really heightened concerns from a civil society perspective with global networks and perspectives. It's really clear that there's heightened vulnerability everywhere. And so those that were vulnerable are even more so today. And I speak here of refugee populations, humanitarian settings, places where there are medical services that have to be reconsidered. In Canada, we can put aside elective services. Maybe we don't need that next, nose job in Canada. But in fact, in many parts of the world, that is not an option. You can't simply assume that supporting COVID response won't come at the expense of truly essential life-saving supports. And whether that's in sexual and reproductive health and rights or other critical areas, there's really a risk of knock-on effects. Access to water and hygiene being critical. And I really want to underscore that the most vulnerable are most vulnerable in Canada, and they're even more so around the world. And I think we have to be really careful of what is to come, because this crisis is leading to many vulnerabilities amplifying. I think of long-term food security and calls from the World Food Program and from others really signaling that we may be heading towards major famine situations in multiple countries, not that far away. And so we've got risks of lower inputs, lower yields. What does that mean for a missed harvest and food security globally? That you could amplify that. Talk about the 1.5 billion children that aren't in school today around the world and what that means for a generation. And I'd like to just point out two more sort of critical pieces that we too often overlook. And those are around the human rights implications of this situation that we're in. We need to advocate for better and more information, PPE for everybody that is on the front lines, but we can't do that at the expense of the human rights that we have. And we've seen too much folding in isolationism, nationalist tendencies in some governments, in some places, disinformation, being truly in a position of putting at risk the global progress that we have seen around the globe in recent decades. And the final piece is gender equality. This is such a gender real scenario. And the fact is that women are more on the front line than men. The social implications of having to deal with being at home, men not working, is far greater on women than it is on men. We need to put that lens on our response around the globe. Civil society has been pushing for progress and feminist principles and approaches around the globe, and particularly Canadian leadership on that. But we're at very high risk of seeing backsliding in these areas. And so those are some of the things that we're watching. There are many more, but Canadian agencies are very much part of that response. And having this conversation about how do we make sure that we include a global response as we look at protecting Canadians and citizens here, is really critical. We need a global response to a global pandemic. If anything, this crisis shows us that we're not alone, and we can't pretend that we can protect ourselves by putting walls up.
I couldn't agree more with that. I think, you know, the ramifications of what is happening now are going to ripple out across the world, you know, for years to come now. And I think Peter was suggesting that too earlier. This is not going to be something that is resolved in 6 months. So I want to turn to Jennifer, because Jennifer represents a foundation that has invested enormously, particularly in Africa, in the kinds of issues that you were talking about, Nick, but in particular the young people of Africa, trying to support their development, their integration into the workforce, into the acquisition of skills that is going to allow them to have sustainable livelihoods and productive lives. This pandemic is going to be huge for them. So Jennifer, maybe you could tell us a bit about the impact that this may have, this crisis, on the major strategy that you announced fairly recently, actually. It's a shift for MasterCard in Africa, but also with Indigenous young people in Canada, where you're applying, I think, a similar approach to their opportunities, to their development. So what impact has the crisis had on your strategy? And do you think that there is going to be a shift? Do you see a need to work with more multilateral partners, perhaps?
Yes. Well, thank you. Thank you very much, Hilary. And it's a pleasure to join this panel today. Really appreciating the commentary already, and really want to echo many of the sentiments that have been shared. And certainly in echoing the sense of solidarity, certainly our foundation felt very compelled very early on that this was a real moment of stepping in and stepping up for our foundation. And this has much to do with, as you mentioned, Hilary, we've recently brought forward a major strategy called Young Africa Works over a year ago now, which aims at enabling 30 million young women and men in Africa to transition to meaningful, dignified employment. And this really reflects much of the analysis that we've done together with partners in Africa, as well as the multilateral organizations, really thinking about the global challenge of youth unemployment within Africa. We know by 2035 that 50% of the world's workforce will be African. And so really it's grounded in this tremendous sense of optimism for Africa's future. If we can get the youth employment challenge right, if we can back young people to pursue their dreams and their livelihoods. So certainly the Young Africa Works strategy was a major push by our foundation, which built on almost a decade of work prior with African partners, really focused on youth education as well as financial inclusion. So this really culminated in Young Africa Works and had us working much more in country and directly with country strategies to align aspirations and areas of growth with African nations. So really sort of joining up in partnership with African institutions and African organizations to think through this challenge together in genuine partnership. Very much the same as you referenced, but we're engaged as well in Canada with Indigenous communities on very similar premise in terms of engaging with community to think about community aspirations that overcome many of the historical inequities and really get behind communities and young people leading for the future. So this is where we're at as a foundation, really last fall with a major announcement shifting the work of the foundation into a very focused strategy. And now faced with a situation like the pandemic, it immediately drove the foundation to think very differently about how we need to react, how we need to support our partners to be not only first and foremost to respond effectively, but then also to build resiliency for the future. And I think our initiative, which was announced on April 9th, which was a dedicated program and initiative, the COVID Response and Recovery Program, was very much geared to do both of those things, to firstly respond very quickly, very nimbly to urgent needs that we're seeing. And this is with regard to healthcare workers, as well as emergency funds for young people that were caught up. Many compelling stories of young people being caught up in between studies, between countries, both on the continent and here within Canada from remote communities, and really ensuring that those young people had a lifeline during this period. And then at the same time, thinking about the longer term, thinking about the connections to how we help build organizations to be resilient in the future. And so here we look at access to financial services for small and micro businesses, enabling e-learning for young people and building that infrastructure in a very robust way, and supporting the adoption of digital solutions, again, for those very small entrepreneurs and micro businesses, so that this period is a time where those small businesses, which are critical in critical sectors like agriculture that Nick mentioned, right? We see that this is a time that should be a critical time of planting in many places. That disruption, market disruption and disruption of the agricultural cycle is potentially, will have a very dramatic impact. So what are the ways in which our foundation can respond very nimbly to those urgent situations, and then as well build in the resiliency for the future? So it's changed our work in very dramatic ways, where we carry on absolutely with Young Africa Works, and there's been a very strong communication to partners to say there's no pulling back, there's no pushing to the back burner, but there's increased flexibility because we know what is happening. So full steam ahead, understanding a new context. And then we've added a whole new initiative, which is the Response and Recovery Resiliency Program, which is dedicated to emergency supports as well as building resiliency for the future. You mentioned around working with multilateral and multinational organizations. Certainly this has been a key part of our work. Since 2008, we've invested over 100 million in our work with many of the UN organizations, including UNICEF and the Food and Agricultural Organization, many others. Currently, we've already engaged through our program with the Red Cross, with UNICEF, organizations that have that ability to very quickly work on the ground directly with the most vulnerable. So we're keen to look at that, as well as looking at our partnerships with African organizations to ensure that this time is one where they can not only navigate this crisis, but they begin to build some of the infrastructure which is going to enable a more resilient future. So it's had a very immediate impact. It's been a huge challenge and shift for our organization, but one that we feel very pleased to be stepping up with our partners to ensure that we're all playing a role in this important time.
Thanks very much, Jennifer. And I find it interesting in your description of how you've responded, how the foundation has responded, that you are putting as much focus on the kind of building resilience of the partners that you have, as much as providing relief. And I think that's an important theme, actually, and something that we can think about as we discuss more broadly, you know, what the role of philanthropy may be. You know, there is always the immediate, the short term, the importance of you know, responding to the emergency, but there's also this very important function, I think, of trying to address capacity, need for capacity building, need for more resilience, you know, because long term, A, this isn't going to pass for a long time, but B, it may happen again. And, you know, the World Health Organization, I'm sure, will be warning us again, unfortunately, hopefully not for another 100 years, a pandemic of this size, but these things are, you know, part of an interconnected world. So I want to turn to Benoit and ask him to tell us a little bit about Kbf Canada Foundation, which is a relatively new player on the Canadian scene, but of course connected, as Inez mentioned in the introduction, connected to the Kingwood Foundation of Belgium, which is a big international player, not simply the largest foundation in Belgium, but one that historically has played a role in Africa and around the world. And Benoit, maybe you could tell us a bit about why Kbf Canada Foundation became a partner for the WHO Solidarity Fund. We can come back to what we were talking about with Peter at the beginning.
Thank you, Hilary. Yes, so we created the Kingwood Foundation in Canada quite recently, in 2017. And the Kingwood Foundation as such has been created in 1976 in Brussels, as you explained. And I will say the last 10 years, it has really been part of the strategy, of the vision of the foundation to facilitate international philanthropy. I mean, each country has specificities, and we see much more donors, foundations and corporates in this global world, in a world also where there are a lot of diaspora communities, of migration, of people wanted to express their solidarity directly to certain communities in another country. And that's not always very easy. So we, besides supporting many local projects, and I don't want to oppose local and global philanthropy here in this seminar, because I really think that, I mean, it's end-to-end. The local action and global reaction are both very important, and we shouldn't oppose both of them. And certainly I would say in the foundation sector, which is, I mean, most of the foundations that I know, and I think it's quite representative of the sector, they are quite, I mean, they are very focused locally on a specific thematic, on a specific region. But here in this case, to address this pandemic, I really think that local answers and global answers are really important if we want to achieve a real impact. And so we have a foundation in the US. We started the foundation in the US in 2000, so 20 years ago. And with the success of the foundation in the US, we decided to create the foundation in 2017 in Canada. And so, generally speaking, we see a really growing appetite from donors, from foundations, from corporates to support international charitable projects, certain communities that they know. Maybe they worked in a certain country, maybe they are coming from a certain diaspora, and they want also to be part of the solution in the country where they originate. They want to support a school in Africa, they want to support a specific hospital in India, they want to support scientific research on a specific rare disease, because they know that the best researchers maybe are not in Canada, and they want to have impact on this disease. So yes, globally there is this appetite, and it's clearly growing. Of course, as a second point, I would like to say that there is a very specific legal context. I guess we speak here today about with many foundations, and so you know that if we manage projects outside of Canada, most of the time we have to do that with our own team, or you do that through an agency agreement. And so you should keep the direction and control of the project, which is time consuming, but very important because that's the legal context. And I think, Hilary, you know that very well as part of the work that you do at the Charitable Commission. But when we heard that WHO wanted to create this fund, we thought, okay, maybe we are quite a modest partner in this matter. I mean, technically speaking, WHO is a qualified donee according to the CRA, meaning that we can and we are allowed to make a grant directly to the WHO. The thing is that the WHO is not organized to work like this so far. So there is a need for specific partners in different countries. And for Canada, we are the Canadian partner and happy to do so, because even if, I mean, we can say WHO is not perfect. And of course, WHO is not perfect. We can say that it's maybe bureaucratic, maybe a bit like all big organizations. But at the end of the day, if we are quite happy to support them, because if we would decide, okay, we don't need WHO anymore, I'm quite certain that within a few years, someone will have the great idea to recreate a kind of WHO. And then when we see all the donations coming from more than 3,000 Canadian individuals, I mean, it's people who don't have so much money. I mean, they give 25, they give 50, $100. It means a lot for them, but it shows that they believe that without a global reaction, without coordination of research, it's going to be quite hard to get to a vaccine and also to specific medication. So yeah, so we are registered by the CRA, and we are able to collect the donation, and then I'm very happy to send them to the WHO, besides other projects where we are much more involved in the direction and control.
Thanks, Benoit. That's useful in terms of understanding giving an opportunity to Canadian foundations and individuals to give to the Solidarity Fund and receive either if you're a donor, a tax receipt, or if you're a foundation, to know that you're giving to a qualified donee. That being said, perhaps we could spend a bit of time back on this, the Solidarity Fund, because I think it is interesting to explore that structure. It's a new structure, you know, hasn't been set up before. It'd be interesting to hear Peter talking a bit more about, you know, what maybe what the thinking was at the WHO and perhaps at the UN around setting up this kind of fund. And I'm interested actually in hearing a bit more about the engagement with donors. It's difficult for the WHO, obviously, which is not set up to do it, to respond to individual donors, but certainly in terms of how you're going to communicate what this fund is being used for in broad terms. You know, how do you see that? And before I give it back to you, Peter, let me just say to participants that if there are questions really of any kind on any of the things that have been said so far, or things that have not been raised yet, please do send them to Inez. She will ask them on your behalf. And we are setting aside some time at the end of this for those questions. So I encourage you, if you have a question, to please send them into Inez now. So Peter.
Thank you. I mean, let me just say that I'm happy to engage with myself with the audience here. I'm at Peter A. Singer on Twitter. I'm easy to find. And maybe at the end of this little answer, I'll tell you why I'm happy to do that. So please feel free to reach out. Also just want to say, well, you know, we do so much thinking, Hilary. Let me just talk about 3 emotions or 3 feelings in response to your question. And those are hope, pride, and thanks or appreciation. In terms of hope, I'd like to let people know that I had COVID, as did my wife. And we went through it, and we were very fortunate to recover. And we mourn those who didn't. But for me, that really personalizes the idea of hope. We're going to get through this as a world if we work together. Second point I wanted to make was around pride. I feel so proud to work with Dr. Tedros, with my colleagues in the WHO. Nobody in this response is perfect. Nobody's ever perfect in emergency response. But I feel so proud of the response, and I really know WHO is making a difference, including on the ground. I mean, imagine a big airplane showing up in Rwanda with tons of medical oxygen and masks, and that's the pride I feel in WHO, but also the public health issues, the guidance around testing, and tracing, and the warning, because Dr. Tedros warned early and often through January and February. So pride, and also pride in Canada, which has such a strong commitment to multilateralism, and what the government of Canada is doing, supporting multilateral organizations, is fantastic. And then let me end with the emotion of thanks and appreciation. Of course, I want to thank the 279,000 individuals, but I particularly want to thank those that Benoit spoke about, the Canadian individuals, companies, and foundations that have joined us in the Solidarity Fund. To me, as a Canadian who's working at the World Health Organization, as a senior United Nations official, I feel very proud when those two worlds come together. And I feel proud because of the impact that we can have. And we need to have that impact because, as you said, this is the biggest crisis in public health in 100 years. And you can't separate the Canadian part and the global part. We're all in this together. We have to solve it together. And that's why I'd be so thrilled to hear from anyone in your audience, because we have to be able to communicate with each other. We have to show each other what we're each doing for us to be able to solve this problem together. And it's going to take that kind of all hands on deck approach to solve what Dr. Tedros has referred to as public enemy number 1, which is the COVID virus. Thank you, Hilary, for the opportunity, and Inez and the other panelists to appear here and to speak.
You're not off the hook yet, Peter. You're going to be, I hope, answering some questions. Inez, are there questions that you're receiving, or should we carry on a bit more with the conversation?
Let's carry on with the conversation. I'm trying to stimulate the conversation with the participants in the meantime.
Okay. So, you know, I want to carry on a bit more, Peter. I have to come back again to this question of, I guess, you know, engagement with donors and foundations. You know, it's the foundation world in Canada has not been, I guess, broadly speaking, and I'm making a very big generalization here, but, you know, the foundation world in Canada hasn't been deeply engaged with a lot of international organizations, or even, and Nick, I'm sure, would be able to comment on this. You know, it's the portion of foundation grants annually that go to Canadian-based INGOs or to multilateral organizations. While the data is not perfect, I admit, you know, has been a reluctance on the part of foundations to make donations to international causes. The MasterCard Foundation is a huge exception, literally huge. So big, actually, Jennifer, that, you know, in the days when I was at PFC, trying to put together data on foundation grants in Canada and the patterns of foundation giving in Canada, we always had to back out the MasterCard Foundation because you are so big relative to others. But you are a laudable exception. But generally speaking, you know, there is, even though there is, I think, a great generosity on the part of individual Canadians towards giving globally, and there is a diaspora giving, which Ben was talking about, and which, you know, has also resulted in, I think, a good deal of interest in what Kbf Canada can offer. There's still, I would say, you know, less attention paid to global issues and to giving globally than one would expect. So I just want to throw that question out to everybody. You know, is that, yeah, Nick, go ahead. Yeah, you got to be unmuted. Nope, still can't hear you.
Okay, hopefully this works. Okay, sorry. No, thank you for that, Hilary. I think it's an important point. And, you know, Canadians have every right to be proud of our contributions globally. But we sometimes actually don't know all the data about how we do contribute. And we know Canadians are very generous, and foundations are a part of that sort of generous spirit. 6% of Canadian individual donations go to international causes, and that we know that the vast majority of donations go to religious organizations and educational institutions and hospitals. And once you back those out, I mean, it's actually a significant share, 6% that goes to international causes. That said, those are individual donations, and we have a sense of our collective contributions to global progress that we perhaps overinflate in some respects. And I wanted to make a point on this because we look at Canada as a big global contributor. But in fact, in a proportional sense, we are not. We only give 0.27% of our GDP in official development assistance. This lags far behind other OECD countries. And so we think we're great and great donors, but in fact, it's the lowest point in 50 years in terms of our contributions. And that's a significant point to keep in mind, because even as our government has responded to this massively domestically, in fact, internationally, the contributions that they've made are not new money. And so they're repurposing existing budgets. And that's really significant because Canada can't go without doing its fair share. We're talking about the largest crisis, political or health crisis, that the world has seen since the Second World War. We have to be part of that global contribution, that global solidarity. You know, we came out of the Second World War having made contributions equivalent in size to the domestic response to COVID, you know, in inflation sort of dollar adjusted dollars. But we then built a whole new global order that served to be a rules-based order, established really many of the parameters that allow us to operate well as a country and to thrive. And I think that it's really important that we seize this moment. This is really a moment to commit, to double down, and to rebuild the world that we want. We've seen too much backsliding in recent years around isolationism and and really threats to democratic principles that we uphold. And it's time for Canada to be part of that rebuilding. You know, the WHO is being criticized a lot these days in some quarters, but the fact is they're part of what we need. We need a robust global health system, and this is the time to really get engaged, be part of that global solution. And I think there's a real role for Canadian philanthropy in this, because we've seen too little philanthropy in these spaces. I don't know what it is about the Canadian psyche, and we've had conversations. In fact, I think I've had some of them with you, Hilary, about what is it that explains this? Is it that Canadians are insular about their interests? Is it that we don't know the impact that we have globally? You know, we have Canada's largest charity is actually an international organization. It's World Vision. So there's real desire and capacity by Canadians to do global good. But we can mobilize philanthropic support, I think, in catalyzing a couple of things. There was a tip around direction and control. There's a lot of interest in seeing change in that right now. Foundations could be a part of that change today because political mass leaders are seeing the importance of that issue. I think there's advocacy needed for an increased role of Canada in the world. And foundations can be a part of saying we need to be part of that global solution and answer. And I think we need to be building awareness around the international dimensions of this crisis. My big concern, my biggest fear is this us versus them narrative. It is really not helpful. We have to be contributing to domestic response while we recognize and become active contributors in the global response.
That's a great set of points, Nick. I really appreciate that, and I appreciate the mention of advocacy. I actually think this is an underplayed role. I have thought so for some time. I think that foundations in Canada have the opportunity, and they also have scope to be advocates for a global world order. It doesn't have to be the world order that we have today. I'm not saying that the world order we have today is without fault or that it can be supported. And I don't think you're saying that either, Nick, or you, Peter. You know, there is a role for reform, and I think it's a role that Canada can play. I'd like to see a better articulation, I guess, from our government of what the objectives might be if we wanted to reform the world order once this crisis is over. Because it can't just be about criticizing structures like WHO, which may or may not have played the role that they should have. Yeah, I think what we're hearing from Peter is that, in fact, WHO has played exactly the role that it should play. But there is going to be, I think, some movement, some interest in change. I don't know if Canada will succeed in getting a spot on the Security Council, but that may not be required for Canada to raise its voice and to be more effective globally. And I think that Canadian foundations can play an advocacy role that goes beyond the funder role. I've always been of the view that funders are much more than funders. Foundations are more than funders. You know, they are conveners, they are network builders, they are investors in capacity. Maybe we could come back to that question about capacity and how you invest in capacity. And maybe Jennifer, you know, if you wanted to comment on that. You know, I do think that there is an ongoing role for philanthropy in building capacity around the world within communities. And you know, the pandemic has just made all of these issues more visible. So do you want to comment on that? I'm putting you on the spot a little bit here, you know, not just.
I appreciate that, and really appreciating Nick's comments as well. And I couldn't agree more that Canadian philanthropy has such an important role to play here. And I think, you know, and we see it, especially through the pandemic, where the interconnections of our world are all the more apparent right now. And I think we see the very values that our foundation has taken forward in our work, values around co-creation and listening and humility, values that I think are uniquely and importantly Canadian, quite frankly, are the very values that make our work on the continent, where we receive so much gratitude and appreciation for showing up with those values. And I think they're more and more important right now, where that notion of showing up and learning together, sharing together, it's been really remarkable, the fact that we work with Indigenous communities here in Canada and with young people in Africa, the opportunities to connect those communities, the rich learning and innovation that comes to the forefront through those connections have been really remarkable. So I just want to add my voice to encouraging that I think this is a unique opportunity for Canadian philanthropy based on those values that I think all Canadians hold dear around showing up in a different way, showing up in partnership and solidarity, not with solutions, but in solidarity, because we're all in this together. And so how do we step up with the responsibility that is needed? I agree. I think often Canadians think that government is taking care of that role in the world. But I think this crisis certainly makes it very clear that every one of us in our capacities have that role to step up. And it is through supporting the capacity of community-based organizations to be resilient through this period that we will be positioning the world in a better, stronger place in the future to deal with this in an ongoing way. And without that stepping up, we're going to continue to have challenges that will impact all of us. So really an important point. Thank you.
Well, thank you, Jennifer, and thank you, and very well said, very passionately said. Inez, I think you have a question?
Yes, so I got a couple of questions. I'll start with the first one. So there's a question about the fact that there's currently a lot of funding flowing into emergency response. And so what do you think will be the funding, what would the funding landscape look like in the medium and short term? And will there be funding shifts from other important issues towards COVID-19 response? And finally, how can we, as foundations, so this is coming from a foundation, best make sure that we address funding gaps rather than duplicate existing efforts?
So, Hilary, maybe I could jump in on that. That's a great set of questions, and it is important, I think, and I think this is a benefit of the Solidarity Fund. So, you know, what does the Solidarity Fund concretely? It funds the gaps, and they affect communities around the world, and they affect Canada. So just to take a few examples, it funds the data and early warning and surveillance and the support to countries around the world to actually see what's happening in their countries and the diagnostic testing. It supports the supplies, the personal protective equipment, the oxygen, very concretely, very on the ground, delivery with the World Food Program, et cetera. And it funds the science, the development of therapeutics, vaccines, et cetera. The whole idea behind the Solidarity Fund is it's very flexible funding. So every week the disbursements go to WHO and other partners essentially to fill the gaps. So very concretely, those are the types of things that the Solidarity Fund funds. And I guess what I want to emphasize is that affects countries around the world, and it affects Canadians. We will be the beneficiaries, Canadians will be the beneficiaries of a vaccine. Canadians will be the beneficiaries of the compilation of knowledge around the risks and the public health steps that need to be taken, for example, as the lockdown is eased, the sharing of lessons from other countries. So these are the types of things very concretely that the fund funds. And having been a funder myself, Grand Challenges Canada dispersed about $50 million a year, fully recognize the need to think both globally, and most of our funds went globally, but also locally, which is why we launched an Indigenous Innovation Initiative. And so this is all together. The Solidarity Fund is a great vehicle, and I'd love to continue to engage with people as we move forward. Thank you.
Thank you very much, Peter. You've gone dark in the background, so I don't know what that means. The sun has set in Geneva or what? Nick, you had your hand up, I think.
Yeah, I wanted to take on this question too, because I think I spent a good chunk of my career doing humanitarian response and a lot of disaster-related fundraising, you know, Haiti earthquake, Asian tsunami, and those sorts of things. And what I will tell you is it's not a zero-sum game. I think we know that. I think people will give when there's a major need, and we see bumps in those times. It's not necessarily going to rob from other sort of sources and contributions. But we do have to be aware and careful of this specific point, because there is a phenomenon here where we are going to find ourselves with programs for a variety of reasons turning towards the immediate. And it's necessary to do the immediate. It also is challenging organizations fundamentally on their business models in ways that we are not yet fully realizing. I think charities in Canada are talking about this already, and it's true across the full spectrum of charities, and it's no different for international organizations. But the initial sort of shock on revenues is probably going to be compounded in the months to come as we see fundraising drives not being able to happen, sunk costs having sort of playing their way through the systems. And I think that's a place where particularly philanthropy has a really important role as a catalytic support to act counter-cyclically, to acknowledge in ways that the average non-initiated donor wouldn't be able to do in terms of supporting organizations in that transition. And I think there are some really important points on this. I mean, frankly, and I'm sorry to go back to it, but advocacy is dramatically underfunded. And I mean advocacy in a variety of fronts. So for example, advocating for the well-being of the charitable sector and its ability to deliver is something that we can't fundraise for, or individual organizations can't ask for donations from individuals in the public because they will be drawn to the emergency response. And that's fine, it's the nature of things. But foundations really have an opportunity to be catalytic in supporting a range of things that come to mind around advocating for a better, more comprehensive response from government, supporting mergers and partnerships between organizations as they use these moments to actually move towards being even more able to contribute to positive change in the future. And I think around supporting business model transitions that are, I think, inevitable and going to shake their way through the systems in the year to come.
Well, and thank you very much. And I can't resist adding advocacy for policy and regulatory reform, direction and control, but also other things that, are outmoded in terms of how charities are regulated and that impede them in their ability, and this would be foundations too, in their ability to respond nimbly and effectively and across a broad range of issues and in many different ways. Benoit, did you have your hand up, or was that just you?
Yeah, no, yes. No, I think it's very important for the foundations not to stop their normal programs and to divert this financial means to the COVID-19, but more, as Nicola said, to say that, okay, maybe they need to ask to the board a specific budget to add to the annual budget to respond to the crisis. So not to divert some means, but to ask for a specific crisis budget, even if it might be difficult for some foundations. I mean, we live with an endowment for many foundations. And of course, when we see the stock market crashing, it might create a fear. Yeah, it's really trying to advocate for a specific one-off specific budget. Yeah.
Hilary, if I could just add, I think it's really important for every foundation to have a strategic discussion with their board in depth about COVID, because the world may not look exactly like it did before. You should look forward strategically and think about how that implicates your foundation with your purpose. People die from at least 3 ways here. You can die directly from the virus. You can die because other essential health services are being cut back. As you were asking before, we've already seen immunization rates drop and malaria rates potentially starting to rise. And people can die of poverty. So if you take the MasterCard Foundation, for example, it's extremely important what the MasterCard Foundation is doing, focusing on young people, jobs in Africa, because poverty also kills. So it's just a good proof point. And a sad proof point that I think every single person listening in this seminar should think about COVID from the lens of their own purpose, of their own mission, because the world may not look different. And each of us and every foundation that's listening has a very important, but potentially a different and strategic role to play in creating that building back better, if you will, or that future to come.
Inez, thank you, Peter. Inez, do we have any more questions?
Yes, we do. Some of it has already been answered, but perhaps we can open the floor. One of it is considering the immense needs, in terms of at the international level. And we do have, smaller foundations that would like to contribute, but do not necessarily know strategically how to approach this. Do you have any, advice on how they can contribute to the response, but in a more strategic and smaller, more modest way?
Anyone want to address that? There are, I think part of the answer is that, yeah, sort of Jennifer, I'm just going to say that there are multiple opportunities, I think, and the question is, how do you choose? How do you select from many possibilities? I think it depends a bit on your mission. And, on that strategic conversation that Peter is talking about, I think perhaps the need to have a strategic conversation about the impact of COVID is sooner rather than later. Although you can divide it in terms of your thinking into what do we do in this immediate period, perhaps what do we do in this next 6 months, in which, we're going to be seeing investment returns that are scary. Investment committees are all going to shake their heads and be very concerned. And there is going to be a pendulum swing as people start to take in the impact of the last, 2 years on their endowments. So there's a danger period coming up here, I think, where foundations could easily say, no, we're going to have to pull back now. We can't afford it. But there's a longer term strategy that I think foundations should be thinking about, and it's not too soon to think about that, which has to do with some of what we've discussed earlier around questions of building resilience, building capacity, investing in the long term. There will always be humanitarian need, and some of it may in fact be frightening over the next year. I think poverty and famine are going to be with us. Africa is, you said it, Peter, it's going to be potentially very scary what we see, and a tremendous human need. But that doesn't mean that foundations cannot consider, what are the best choices for us? We cannot feed everyone, but we can do a bit, and we can also think about still rebuilding for the long term. So Jennifer, I think you had your hand up on this.
Yeah, very much just echoing your comments there, Hilary. I think that was very much the analysis that our foundation went through, was really thinking about this moment, thinking about the ecosystem of actors that we engage with for our work through Young Africa Works, and thinking about what are the ways in which we need to be nimble and flexible and responsive right now, so that whole ecosystem of partners emerges from, not only survives, which is case in point, an important part of this, but also emerges and can be resilient and buffered for the future. So I think it is going through that thinking of the ecosystem and where we work, and also understanding, what began as a public health crisis very quickly became an economic crisis, right? So very, very quickly, you see the ways in which this situation connects to all the pieces around us. So I think it's less about thinking about specific projects or ways to engage, but more thinking about that whole ecosystem within which we all work, in which we're all impacted, and think about the ways in which we can be flexible, nimble, very responsive. And I think ultimately, very much the role of philanthropy in moments like this, to be thinking in those different ways about, how can we mobilize resources, even, given all of the economic considerations, this is absolutely a time to mobilize resources to be able to buffer for the long term.
And Hilary, if I could just go to the nubbin of your question as well, which was a great one. This is $1 trillion problem, multi-trillion dollar, and it's different from the financial crisis because it's not about the financial markets, it's about the real economy. And that's come to a standstill in many parts of the world, and at the heart of that is the public health problem. So the overall problem is in the trillions. The fundraising is in the billions. For example, there's a multi-billion-dollar target at the pledging conference for governments and others. Foundations and so on, Wellcome Trust, Gates Foundation on Monday in relationship to the thing I mentioned, the access to COVID tools, the vaccine, et cetera. The Solidarity Fund and many other charities operate in the range of millions or tens of millions. But the point I want to make is that the reason, and I said this at the outset, the real issue in these funds and that what your audience should be thinking about is strategy, however much they can, keeping in mind that strategic discussion I mentioned. But the most important thing is solidarity. It's the engagement. And that's what the Solidarity Fund is about. And that's what other funds are about as well. You asked me why we launched the Solidarity Fund. And I didn't say to raise money, even though it raised $200 million. And that's very, very helpful. And it's deeply appreciated. I said because we had to solve this problem together. And solidarity. And maybe that line of thinking as you go from trillions to billions to millions to whatever individual foundations and individual donors are comfortable with in terms of solving this huge once in a 100-year type problem, which will fundamentally transform the way we live.
Thank you. Very well said. Inez, are we, do we have any more questions?
Yeah, I guess I have a question, but it's more about, the cost of inaction. A lot of, our foundations are wondering how to, collectively, how to participate in this collective effort, but really what is the cost of inaction according to you? Because, I'm sure there's data around, I haven't seen it. I know in sustainable development and environmental discussions, we always talk about the cost of inaction. And I think the cost of inaction is so much more than those trillions that Dr. Singer was mentioning. And so, what would that look like? And not that I want to be alarmist, but I do think, we are at a, very key moment in history right now. So.
Peter, Nick, we'll give the word to Nick.
I'll try to be brief because I think this is such a huge question in this, and we always struggle with, the things that could have been. I think there are many sort of branches to the potential future today, but I really am existentially challenged, as I think we all are, with the fact that this is the biggest global crisis in a generation. And it has to be a moment where we make critical choices to engage, to build a better future. And there are dark paths possible, through isolationism and a fold back and lack of investment in global infrastructures, where we fall back in an us versus them narrative, where there are more wars and greater suffering and greater loss of life. There's rollback of democratic principles of gender equality progress right across the globe. And we can't have those things. So what do we do to make that direction be a positive one? And I think it's engage, double down on how you engage, regardless of where that is and how, make those strategic decisions or conversations, have them, as has been suggested already. I think we really need to be positioning ourselves for the long haul. There are going to need to be major investments by countries like Canada who have the means to be part of a global solution. Too many of the other actors that are out there are not positive actors, and they have a big outsized influence. We have to be acting and providing examples of how we can make change. And I think there are catalytic things that foundations can do in that space. I think of some of the things that are always dramatically underfunded. Coordination is one of those. Advocacy and policy work are other ones. But when it comes to this issue, if we talk about just Canada, we're in trouble, because the global solutions are the ones that will allow us to protect Canada, but actually prosper in the long run, as the big changes and decisions that were made after the Second World War allowed Canada to prosper in the last 70 years. So I think it's really important to, yes, you can talk about the cost of doing nothing. Those numbers are beyond scary, but that's not what we want. And so how can we get there? It's by sort of doubling down and acting forward.
I can't improve on that, and I'm glad you mentioned the example of sort of how the world came together after the Second World War. We could have a post-First World War scenario, or we could have a post-Second World War scenario, and let's hope that it's the second. Let's hope that there is creativity and imagination and innovation that's being applied to thinking through how the world is going to manage some of these global issues. We haven't talked that much about climate change, but as you mentioned it, you know, I mean, this is the crisis that is all around us, and that is, you know, it's for now overwhelmed by the pandemic, but it hasn't gone away. So, you know, needing to think about structures that can cope more effectively against the forces of isolationism, and in a world in which there is no unquestioned leader, as there was with the United States and, you know, the world after World War II.
And you can't separate the global from Canada. I mean, Nick spoke very eloquently about the global cost of inaction in response to Ness's question, and I won't add to that, just to say fully agree. But let me ask everyone listening to ask themselves, when was the last time nationally within Canada we were in a bigger crisis? And you mentioned the Second War. That would be my answer. But, you know, this is an enormous domestic crisis and an enormous global crisis. They're inextricably intertwined. And we all need to work together with national unity and global solidarity to solve both at the same time. And that's the question I think you started with. Essentially, why should Canadian foundations care? Canadian foundations should care because this is a global problem. It's a Canadian problem. We're fortunate to have the leadership that we have in Canada on the crisis, but the problems cannot be separated and they must be solved together. And that's why this conversation is so important. It's the biggest public health problem in 100 years, and it's probably the biggest, well, I mean, people can decide for themselves, but I would have answered that question since the Second War. It's the biggest national crisis. But be interested in any greater crisis between, you know, 1945 and now.
I know that we're winding up. We're just about at the end. So we've had such amazing statements just now from Nick and from Peter and from Jennifer. Benoit, maybe I'll just give you an opportunity of something that you wanted to add that you've not had an opportunity to, and well, thank you all.
I just want to say that it's a challenge for the humanity, and it's a challenge for human beings. And just together as human beings, we can make the difference. And I guess it's the same message today to foundations, maybe tomorrow to corporates, to individual donors, and to the public sector. So it's really the same message to all the different sectors of the society. And I guess that's it, and I have confidence that people will react.
Let's end on an optimistic note here. Inez, I'll turn it back to you so that you can thank all of your amazing panelists.
Yes, thank you so much, everyone, for your time and for this very, very interesting and important conversation. I just wanted to thank also all of the participants and remind them that they will be getting a post-webinar email with, you know, a survey. I would also encourage everyone to sign up to our weekly digest and to receive more information on upcoming webinars and resources to support in your work in this time of crisis. Voila, thank you so much, everyone.
Thank you. Thank you very much.
Thank you very much.
Thank you so much, and thank you, Hilary. And thanks to everyone in the audience for the work that you do. Thank you.
Thank you.
Thank you. Goodbye.
Bye.